With the release of the final rule for MIPS 2025, what do you see as the most significant changes affecting the MIPS clients you and your team work with?
For MIPS, lots of things have stayed the same. The performance threshold, that is the amount of points to avoid a MIPS penalty, has stayed at 75 points. The data completeness threshold, that is how many patients and encounters you have to report on, has stayed at 75%. The performance threshold at 75 is through 2025 performance year. CMS has said that data completeness threshold, that is how many patients to report on, will stay at 75% through 2028. So they've projected that out into the future. In the cost category, there have been some scoring changes for the better, in my opinion. The curve has been skewed upward to line up with the medium cost. So accepting if you're on one far end or the other of the scale, the cost performance, how you perform in the cost category, will earn you more points than it has in previous years. So it's less likely that cost will drag down your entire MIPS score. This is great. Lots of practices have struggled with cost, with predicting cost and understanding how to impact it. So with the way they've shifted these scoring requirements, the cost category will be less of a burden as far as points as it has been. Improvement activities, which is another one of the categories in MIPS, there have been some changes there. So previously, improvement activities had high-weighted and medium-weighted activities, and practices had to choose different amounts of different activities. They've really simplified it in a really lovely way. So for traditional MIPS, you have to report 2 activities. If you are a small practice or non-patient facing, or in doing an MVP, you report 1 activity. So we don't need to concern ourselves on high-weighted, medium-weighted, any of that moving forward into 2025. I think that will really help the improvement activities category be more approachable for some practices. Oh, there also is a new extreme and uncontrollable circumstance application category. So after your submission, you would now be able to file an extreme and uncontrollable circumstance hardship if you have experienced vendor issues that have affected your submission. So if you were under contract with someone and they didn't make a submission or made a submission that was incorrect or some other issue, you would be able to address that with CMS so that you don't have to experience any penalty or negative ramifications based on a vendor issue. So that, I think, is a great way for CMS to support the practices and the providers while still acknowledging that, we do want folks to report, but we want it to be reporting in a way that makes sense and is going to be accurate.